cell organelle is responsible for ATP production? Option A, nucleus. Option B, ribosomes. Option C, mitochondria. And option D, Golgi apparatus. The correct answer is option C, mitochondria. Mitochondria are called the powerhouse of the cell because they produce ATP through oxidative phosphorylation. Which blood vessels carries oxygenated blood from the lungs to the heart? Option A, pulmonary artery. Option B, pulmonary vein. Option C, aorta. Option C, superior vena cava. The correct answer is option B. Pulmonary veins are unique because they carry oxygenated blood from the lungs to the left atrium. The functional unit of the kidney is called option A, nephron. Option B, glomerulus. Option C, Bowman's capsule. Option D, loop of Henle. The correct answer is option A, nephron. Each kidney contains around 1 million nephrons which filters blood and form urine. Next question. Which muscle is the primary muscle of inspiration? Option external intercostal. Option B, internal intercostal muscle. Option C, diaphragm. Option D, sternocleidomastoid. The correct answer is option C, diaphragm. When the diaphragm contracts, it increases the volume of the thoracic cavity, causing air to enter the lungs. Where is the sinoatrial node located? Option A, left ventricle. Option B, right atrium near SVC opening. Option C, arterioventricular septum. Option D, right ventricle outflow tract. The correct answer is option B, right atrium near SVC opening. The SA node acts as a heart natural pacemaker and initiate heart contract. Which hormone lowers blood glucose concentration? Option A, glucagon. Option B, cortisol. Option C, insulin. Option D, epinephrine. The correct answer is option C, insulin. Insulin helps cell absorb glucose, thus reducing blood glucose levels. Insulin helps cell absorb glucose, then reducing blood glucose level. The long bone growth in children occurs at option A, diaphysis. Option B, epiphyseal plate. Option C, peristonium. Option D, metaphysis. The correct answer is option B, epiphyseal plate. This cartilage plate at the end of the long bones allows bones to grow in length until maturity. Which part of the neuron receives impulses? Option A, axon hillock. Option B, dendrites. Option C, axon terminal. Option D, node of Ranvier. The correct answer is option B, dendrites. Dendrites receives incoming electrical signals from other neurons. Dendrites receives incoming electrical signal from other neurons. Which blood component is primarily responsible for clot formation? Option A, erythrocyte. Option B, leukocytes. Option C, platelets. Option D, plasma protein only. The correct answer is option C, platelets. Platelets form plaque at injury site and releases factors that start the clotting cascade. Normal adult resting heart rate range is option A, 20 to 40 beats per minute. Option B, 40 to 60 beats per minute. Option C, 60 to 100 beats per minute. Option D, 10 to 120 beats per minute. The correct answer is option C, 60 to 100 beats per minute. A normal heart rate beats between 60 and 100 times per minute at rest. Which organ produces bile? Option A, pancreas. Option B, liver. Option C, gallbladder. Option D, stomach. The correct answer is option B, liver. The liver secretes bile that helps in the digestion and absorption of fats. The gallbladder only stores it. The liver secretes bile that helps in the digestion and absorption of fats. The primary structural protein in connective tissue is option A, elastin. Option B, keratin. Option C, collagen. Option D, actin. The correct answer is option C, collagen. Collagen provides strength and flexibility to skin and bones and ligaments. The next question. Which cranial nerve carries the sense of smell? Option A, first cranial nerve. Option B, second cranial nerve. Option C, fifth cranial nerve. Option D, eighth cranial nerve. The correct answer is option A, first cranial nerve. The olfactory nerve or first cranial nerve transmits smell signals from the nasal mucosa to brain. The next question. The functional structural unit of skeletal muscle is option A, sacroplasm. Option B, sacromere. Option C, myosin filament. Option D, sacrolemma. The correct answer is option B, sacromere. The sacromere between jet lines contains actin and myosin filaments responsible for contraction. Which vessel supplies oxygenated blood to the heart muscle? Option A, coronary arteries. Option B, pulmonary arteries. Option C, carotid arteries. Option D, coronary sinus. The correct answer is option A, coronary arteries. The coronary arteries branch from the aorta to nourish the myocardium. The coronary arteries from the aorta to nourish the. What is the role of surfactant in the lungs? Option A, increases surface tension. Option B, decreases surface tension. Option C, stimulate mucus. Option D, activate cilia. The correct answer is option B, decreases surface tension. Surfactant prevents alveolar collapse by reducing surface tension inside the alveoli. Which vitamin is essential for calcium absorption? Option A, vitamin A. Option B, vitamin B12. Option C, vitamin C. Option D, vitamin D. The correct answer is option D, vitamin D. Vitamin D promotes calcium and phosphorus absorption from the intestine. Vitamin D promotes calcium and phosphate absorption from the intestine. The primary buffer system of the blood is option A, phosphate buffer, option B, bicarbonate buffer, option C, protein buffer, option C, ammonia buffer. The correct answer is option B, bicarbonate buffer. Bicarbonate system maintains the normal blood pH 7.35 to 7.45. Which part of the brain controls coordination and balance? Option A, cerebrum, option B, cerebellum, option C, medulla oblongata, option D, thalamus. The correct answer is option B, cerebellum. The cerebellum integrates sensory input to maintain posture, balance, and fine movements. Next question. Which structure prevents food from entering the trachea while swallowing? Option A, epiglottis, option B, ula, option C, larynx, option D, soft palate. The correct answer is option A, epiglottis. The epiglottis closes over the laryngeal opening to protect the airway during swallowing. Thank you all. The major intracellular cation is option A, sodium, option B, potassium, option C, calcium, option D, chloride. The correct answer is option B, potassium. Potassium maintains intracellular osmotic balance and resting membrane potential. Next question. Which hormone stimulate uterine contractions during labor? Option A, progesterone, option B, estrogen, option C, oxytocin, option D, prolactin. The correct answer is option C, oxytocin. Oxytocin from the posterior pituitary triggers uterine smooth muscle contractions in labor. The primary site of nutrient absorption is option A, stomach, option B, small intestine, duodenum or jejunum, option C, colon, option D, esophagus. The correct answer is option B, small intestine. Most nutrients are absorbed in the duodenum and jejunum via villi and microvilli. The universal donor blood group is A, O negative, option B, AB positive, option C, A positive, option D, B negative. The correct answer is O negative. O negative blood has no AB or RH antigen safe for any recipient in emergency transfusion. Where is insulin produced? Option A, alpha cells of pancreas, option B, beta cells of pancreas, option C, adrenal cortex, option D, thyroid. The correct answer is option B, beta cells of pancreas. Beta cells in the islets of Langerhans secrete insulin. Thank you. Which part of the joint secretes synovial fluid? Option A, articular cartilage, option B, synovial membrane, option C, joint capsule, option D, ligament. The correct answer is option B, synovial membrane. The inner synovial layer produces lubricating synovial fluid for smooth movement. Normal tidal volume in adult is option A, 50 to 100 ml, option B, 300 to 500 ml, option C, 1 to 2 liters, option D, 3 to 4 liters. The correct answer is option B, 300 to 500 ml. Tidal volume is the amount of air inhaled or exhaled in normal breath. Which gland is called the master gland? Option A, thyroid gland, option B, adrenal gland, option C, pituitary gland, option D, pineal gland. The correct answer is option C, pituitary. The pituitary controls several other glands, hence termed the master endocrine gland. The pituitary controls several other glands functions, hence termed the master endocrine gland. Where are red blood cells produced in adults? Option A, liver, option B, spleen, option C, bone marrow, option D, kidney. The correct answer is option C, bone marrow. Red bone marrow of long and flat bones performance hemopoiesis. Red bone marrow of long and flat bones performance hemopoiesis. Which valve prevents black flow of blood from the left ventricle to left atrium? The correct option A, tricuspid valve, option B, mitral valve, option C, aortic valve, option D, pulmonary valve. The correct answer is option B, mitral valve or bicuspid valve. This valve ensures one-way blood flow between left atrium and left ventricle. Which layer of skin contains blood vessels and nerves? Option epidermis, option B, dermis, option C, stratum corneum, option D, hypodermis. The correct answer is option D, B, dermis. The dermis supplies the skin with nutrients and sensory nerve endings. Which part of the ear is responsible for hearing? Option A, pinna, option B, ossicles, option C, cochlea, option D, semicircular canals. The correct answer is option C, cochlea. Hair cells in the cochlea convert sound vibrations into nerve impulses. Which cell mediated immunity? Option A, B lymphocytes, option B, T lymphocytes, option C, neutrophils, option D, platelets. The correct answer is option B, T lymphocytes. T lymphocyte or T cells destroy infected cells and regulate immune responses. The function of hemoglobin is to option A, fight infection, option B, transport oxygen and carbon dioxide, option C, clot blood, option D, produce antibodies. The correct answer is option B, transport oxygen and carbon dioxide. Hemoglobin binds oxygen in the lungs and releases it to tissues, carries some carbon dioxide back. Deficiency of vitamin D causes option A night blindness, option B beriberi, option C scurvy, option D rickets. The correct answer is option C scurvy. Lack of vitamin C impairs collagen synthesis, causing bleeding gums and poor wound healing. Which part of the brain controls vital functions like respiration and heart rate? Option A pons and medulla, option B cerebrum, option C cerebellum, option D hippocampus. The correct answer is option A pons and medulla. The medulla oblongata regulates cardiac, respiratory, and vasomotor centers. The main artery supplying the brain is option A femoral artery, option B internal carotid artery, option C coronary artery, option D renal artery. The correct answer is option B internal carotid artery. Internal carotid and vertebral arteries form the circle of Willis to supply the brain. Protein digestion begins in the option A mouth, option B stomach, option C small intestine, option D esophagus. The correct answer is option B stomach. Pepsin activated with gastric acid starts the breakdown of proteins. The test measuring average blood glucose for 2 to 3 months is option A fasting blood sugar, option B random blood sugar, option C HbA1c, option D OGTT. The correct answer is option C HbA1c. HbA1c shows long-term control of blood glucose in diabetic patients. It is also called glycosylated hemoglobin test. Gas exchange between blood and tissues occurs in option A arteries, option B arterioles, option C capillaries, option D veins. The correct answer is option C capillaries. Thin-walled capillaries allows diffusion of oxygen, nutrients, and waste products. Which hormone increases blood calcium level? Option A calcitonin, option B parathyroid hormone, option C insulin, option D aldosterone. The correct answer is option B parathyroid hormone. Parathyroid hormone stimulate bone resorption and renal calcium reabsorption. Structure connecting muscle to bone. Option A ligament, option B tendon, option C cartilage, option D fascia. The correct answer is option B tendon. Tendons transmit the force of muscle contraction to bones. The lymph nodes and spleen belongs to which system? Option A circulatory, option B lymphatic or immune, option C respiratory, option D endocrine. The correct answer is option B lymphatic or immune. They filter lymph and produce lymphocytes for body defense. T waves on ECG indicates option A hypokalemia, option B hyperkalemia, option C hypocalcemia, option D hyponatremia. The correct answer is option B hypokalemia. Excess potassium in blood affects cardiac repolarization, producing tall T waves. The main function of the colon is option A protein digestion, option B water and electrolyte absorption, option C fat absorption, option D enzyme secretion. The correct answer is option B water and electrolyte absorption. The colon absorbs remaining water and forms solid fecus. Which muscle type is involuntary and non-striated? Which muscle type is involuntary or non-striated? Option A skeletal, option B cardiac, option C smooth, option D tendinous. The correct answer is option C smooth. Smooth muscles of the organs and vessels contract automatically without striations. The organ that stores glycogen is option A kidney, option B liver and muscles, option C spleen, option D lungs. The correct answer is option B liver and muscles. Liver glycogen maintains blood sugar level, muscle glycogen fuels activity. The nerve controlling diaphragm contraction is option A vagus nerve, option B phrenic nerve, option C accessory nerve, option D hypoglossal. The correct answer is option B phrenic nerve. C3, 4, 5, C3, C4, C5 keeps the diaphragm alive. Phrenic nerve originates from these roots. The organ secreting trypsin and amylase is option A stomach, option B liver, option C pancreas, option D gallbladder. The correct answer is option C pancreas. The pancreas secretes digestive enzymes for proteins, carbohydrates, and fats. The blood pressure during ventricular contraction is option A diastolic pressure, option B mean arterial pressure, option C systolic pressure, option D pulse pressure. The correct answer is option C systolic pressure. Systolic pressure is a peak pressure generated when the ventricles contract. Thank you all. Who is the father of microbiology? Option A Louis Pasteur, option B Robert Koch, option C Anton van Leeuwenhoek, option D Joseph Lister. The correct answer is option C Anton van Leeuwenhoek. He was the first to observe microorganisms by using a simple microscope in 17th century. The study of fungi is called option A virology, option B mycology, option C bacteriology, option D parasitology. The correct answer is option B mycology. Myco means fungus. Mycology deals with classification study of fungi. The culture medium used for growing bacteria is option A agar medium, option B distilled water, option C salt solution, option D glucose syrup. The correct answer is option A agar medium. Agar provides a solid surface for bacterial growth and colon formation. The gram stain differentiate bacteria based on option A shape, option B size, option C cell wall structure, option D capsule. The correct answer is option C cell wall structure. Gram positive bacteria retain crystal violet stain due to thick peptidoglycan walls. The next question. Which scientist discovered penicillin? Option A Robert Koch, option B Alexander Fleming, option C Edward Jenner, option D Joseph Lister. The correct answer is option B Alexander Fleming. Fleming discovered penicillin in 1928 from Penicillium notatum. It is the first antibiotic. Tuberculosis is caused by option A Mycobacterium tuberculosis, option B Clostridium tetani, option C Streptococcus pyogenes, option D Salmonella typhi. The correct answer is option A Mycobacterium tuberculosis. Mycobacterium tuberculosis is acid-fast bacillus mainly affect lungs and spread via airborne droplets. Which organism causes tetanus? Option A Clostridium tetani, option B Clostridium botulinum, option C Bacillus anthracis, option D Vibrio cholerae. The correct answer is option A Clostridium tetani. It produces tetanospasmin toxin that causes muscle rigidity and spasms. The causative agent of cholera is option A Salmonella typhi, option B Vibrio cholerae, option C Shigella dysentery, option D E. coli. The correct answer is option B Vibrio cholera. Vibrio cholera is a common coma-shaped bacterium transmitted to contaminated water. Vibrio cholera is a coma-shaped bacterium transmitted to contaminated water. The smallest microorganism is option A bacteria, option B protozoa, option C virus, option D fungi. The correct answer is option C virus. Viruses are submicroscopic organisms that can reproduce only inside living cells. The process of killing all microorganisms including spores is called option A disinfection, option B sterilization, option C pasteurization, option D antisepsis. The correct answer is option B sterilization. Sterilization destroys all forms of microbial life including spores. The bacteria that require oxygen for growth are called option anaerobes, option B aerobes, option C facultative anaerobes, option D microaerophils. The correct answer is option B aerobes. Aerobic bacteria need oxygen to survive and multiply. Which stain is used to identify acid-fast bacteria? Option A gram stain, option B Nielsen stain, option C methylene blue, option D India ink. The correct answer is option B gel Nielsen stain. The stain is used for Mycobacterium tuberculosis detection. The stain which is used to identify acid-fast bacteria is gel Nielsen stain. Who is the father of microbiology? Option A. Which stain is used to identify acid-fast bacteria? Option A gram stain, option B gel Nielsen stain, option C methylene blue, option D India ink. The correct answer is option B gel Nielsen stain. The stain is used for Mycobacterium tuberculosis detection. The main method of sterilizing surgical instruments is option A boiling, option B autoclaving, option C pasteurization, option D UV radiation. The correct answer is option B autoclaving. Autoclaving uses steam under pressure 121 degrees Celsius for 15 to 20 minutes to sterilize. Which disease is caused by Salmonella typhi? Option A typhoid fever, option B dysentery, option C cholera, option D diphtheria. The correct answer is option A typhoid fever. Typhoid spreads through contaminated food and water. It is spread through fecal oral route. The shape of cocci bacteria is option A rod, option B spherical, option C spiral, option D coma shape. The correct answer is option B spherical. Cocci are round shaped bacteria like Staphylococcus and Streptococcus. The disease malaria is caused by option A bacteria, option B virus, option C protozoa, option D fungi. The correct answer is option C protozoa. Malaria is caused by Plasmodium species transmitted by female Anopheles mosquitoes. The father of antiseptic surgeries. Option A Edward Jenner, option B Joseph Lister, option C Louis Pasteur, option D Robert Koch. The correct answer is option B Joseph Lister. Lister introduced carbolic acid phenol in surgery to prevent infection. Which microorganism causes diphtheria? Option A Corynebacterium diphtheria, option B Botrytis pertussis, option C Mycobacterium leprae, option D Streptococcus pneumonia. The correct answer is option A Corynebacterium diphtheria. It produces exotoxin that forms a thick grey membrane in the throat. Which vaccine prevents tuberculosis? Option A TPT, option B BCG, option C MMR, option D TT. The correct answer is option B BCG. BCG, Bacillus calmette vaccine, provides protection against TB. The enzyme present in tears that kills bacteria is option A lipase, option B lysozyme, option C amylase, option D lactase. The correct answer is option B lysozyme. Lysozyme destroys bacterial cell walls, part of natural immunity. The incubation period of measles is approximately option A 1 to 2 days, option B 3 to 5 days, option C 10 to 14 days, option D 30 days. The correct answer is option C 10 to 14 days. After exposure, the measles symptoms appear after about 10 to 14 days. AIDS is caused by which virus? Option A hepatitis B virus, option B HIV, option C influenza virus, option D polio virus. The correct answer is option B HIV. Human immunodeficiency virus destroys CD4 T cell lymphocytes, causing immune suppression. Which bacteria are spherical and arranged in cells? Option is Staphylococci, option B Streptococci, option C Diplococci, option D Bacilli. The correct answer is option B Streptococci. Strepto means chain, Streptococcus forms chain like colonies. The most heat resistant form of bacteria is the option A capsule, option B spore, option C flagella, option D cyst. The correct answer is option B spore. Bacterial spores, example Clostridium, can survive extreme heat and chemicals. The process of using mild heat to kill pathogens in milk is option A sterilization, option B disinfectant, option C pasteurization, option D boiling. The correct answer is option C pasteurization. Pasteurization at 63 degrees Celsius for 30 minutes or 72 degrees Celsius for 15 seconds kills pathogens but preserves nutrients. Which microorganism causes leprosy? Option A Mycobacterium tuberculosis, or Mycobacterium leprae, option C Clostridium perfringens, option D Treponema palladium. Option D. Which micro causes leprosy? Option A Mycobacterium tuberculosis, option B Mycobacterium leprae, option C Clostridium perfringens, option D Treponema pallidum. The correct answer is option B Mycobacterium leprae. Mycobacterium leprae affects skin and peripheral nerves, leading to deformities if untreated. The causative organism of whooping cough is option A Protellella pertussis, option B Corynebacterium diphtheria, option C Haemophilus influenza, option D Streptococcus pneumoniae. The correct answer is option A Protellella pertussis. This bacteria infects the respiratory tract, causing severe coughing spells, that is whooping cough. Which of the following is a fungal infection? Option A Tinea corporis, option B typhoid, option C diphtheria, option D measles. The correct answer is option A Tinea corporis. Also called ringworm, tinea is a skin fungal infection caused by dermatophytes. Which microorganism causes syphilis? Option A Treponema palladium, option A Neisseria gonorrhea, option C Haemophilus tincere, option D Chlamydia trachomatis. The correct answer is option A Treponema pallidum. Which virus causes chickenpox? Option A varicella zoster virus, option B measles virus, option C rubella virus, option D mumps virus. The correct answer is option A varicella zoster virus. Varicella zoster causes chickenpox and later reactivation has herpes zoster. Which organism causes gas gangrene? Option A Clostridium perfringens, option C Clostridium tetani, option C Bacillus anthracis, option D Pseudomonas aeruginosa. The correct answer is option A Clostridium perfringens. This anaerobic bacterium produces toxins and gas and damages tissue. Which of the following is a vector-borne disease? Option A tuberculosis, option B typhoid, option C malaria, option D cholera. The correct answer is option C malaria. Malaria is transmitted to bites of infected female Anopheles mosquito. The virus that causes hepatitis B is transmitted to option A air droplets, option B contaminated food and water, option C blood and body fluids, option D insect bites. The correct answer is option C blood and body fluids. Hepatitis B virus spread via blood transfusion, unsafe injection or sexual contact. The causative agent of rabies is option A arbovirus, option B Lissa virus, option C retrovirus, option D poliovirus. The correct answer is option B Lissa virus. Rabies virus is transmitted to the bite of infected animals. The bacteria normally present in the intestine are called option A pathogenic bacteria, option B commensals. Option C, spores. Option D, parasites. The correct answer is option B, commensals. Commensal bacteria like E. coli live harmlessly and aid digestion. The most common cause of hospital-acquired infection is option A, Pseudomonas aeruginosa. Option B, Staphylococcus aureus. Option B, Vibrio cholerae. Option D, Clostridium tetani. The correct answer is option B, Staphylococcus aureus. Common in surgical wounds and catheter site, resistant strains are problematic. The infection acquired from animals is called option endemic, option B zoonotic, option C nosocomial, option D epidemic. The correct answer is option B zoonotic. Zoonotics are infections naturally transmitted from animals to humans, that is rabies. Which disinfectant is commonly used for skin before injection? Option A phenol, option B formalin, option C alcohol, option D hydrogen peroxide. The correct answer is option C alcohol. 70% alcohol is used to disinfect skin due to rapid bactericidal effect. The optimum temperature for most pathogenic bacteria is option A 0 degrees Celsius, option B 25 degrees Celsius, option C 37 degrees Celsius, option D 60 degrees Celsius. The correct answer is option C 37 degrees Celsius. Most human pathogens grow best at normal body temperature, that is 7 degrees Celsius. E. coli is normally found in option A skin, option B large intestine, option C lungs, option D blood. The correct answer is option B large intestine. E. coli is part of normal intestinal flora but can cause infection if displaced. Which virus causes polio? Option A adenovirus, option B poliovirus, option C retrovirus, option D parvovirus. The correct answer is option B poliovirus. Poliovirus infect the nervous system leading to paralysis in severe cases. The causative organism plague is option A Yersinia pestis, option B Salmonella typhi, option C Vibrio cholerae, option D Clostridium botulinum. The correct answer is option A Yersinia pestis. It is transmitted by rat fleas and causes bubonic plague. Which staining technique uses crystal violet and safranin? Option A acid for staining, option B gram staining, option C capsule, option D spore staining. The correct answer is option B gram staining. Gram positive retain crystal violet, gram negative take the contrastain safranin. The process of removing only pathogens, not spores from objects is option A sterilization, option B disinfection, option C pasteurization, option D antisepsis. The correct answer is option B disinfection. Disinfection eliminates most microorganisms but not destroy spores. The organism that causes anthrax is option A Bacillus anthracis, option B Clostridium tetani, option C Vibrio cholerae, option D Salmonella typhi. The correct answer is option Bacillus anthracis. A spore forming bacterium infecting skin, lungs or intestine considered zoonotic disease. The shape of Vibrio cholerae is option A spherical, option B rod, option C common shaped, option D spiral. The correct answer is option C common shaped. Vibrio cholerae appears as a curved rod resembling a comma. The term pathogen refers to a harmless organism, a disease-causing microorganism, normal flora, beneficial bacteria. The correct answer is option B, disease-causing microorganism. A pathogen invades and multiplies within the host, causing disease. The common cold is caused by option A, rhinovirus, option B, influenza, option C, corona, option D, adenovirus. The correct answer is option A. Rhinoviruses are the most frequent cause of middle upper respiratory infection. The instrument used to observe microorganisms is option A telescope, option B microscope, option C stethoscope, option D periscope. The correct answer is option B microscope. Microscope magnifies tiny organisms invisible to naked eye. The process of converting milk to curd is due to option A lactobacillus, option B Vibrio cholerae, option C Salmonella, option D Bacillus anthracis. The correct answer is option A lactobacillus. Lactobacillus ferments lactose into lactic acid that thickens milk into curd. Thank you all. The main aim of nursing is to option A diagnose disease, option B cure diseases, provide holistic care to the patient, prescribe medicine. The correct answer is option B provide holistic care to the patient. Nursing focuses on the total needs of the person, that is physical, mental, social and spiritual need. The founder of modern nursing is option A Clara Barton, option B Florence Nightingale, option C Mary Seacole, option D Virginia Henderson. The correct answer is option B Florence Nightingale. Florence Nightingale organized modern nursing practice during the Crimean War. Florence Nightingale organized modern nursing practice during the Crimean War. The nurse-patient relationship is based on option A sympathy, option B money, option C trust and understanding, option D orders. The correct answer is option C trust and understanding. Mutual trust builds confidence and promotes recovery. The normal body temperature is 96 degree Fahrenheit, option B 98 degree Fahrenheit, option C 100 degree Fahrenheit, option D 102 degree Fahrenheit. The correct answer is option B 98.6 degree Fahrenheit. Normal oral temperature is 37 degrees Celsius, that is 98.6 degree Fahrenheit. The pulse rate is commonly measured at option A carotid artery, option B brachial artery, option C radial artery, option D femoral artery. The correct answer is option C radial artery. The radial pulse is easy to locate on the wrist and convenient for routine checks. Respiration includes option A inspiration only, option B expiration only, option C inspiration and expiration, option D pulse and temperature. The correct answer is option C inspiration and expiration. Respiration is one complete cycle of inhaling and exhaling. The blood pressure is measured by option A thermometer, option B stethoscope, option C sphygmomanometer, option D pulse oximeter. The correct answer is option C sphygmomanometer. It measures systolic and diastolic pressure in mm of Hg. Normal adult respiration rate is option 8 to 12 breaths per minute, option C 12 to 20 breaths per minute, option C 20 to 30 breaths per minute, option D 20 to 40 breaths per minute. The correct answer is option B 12 to 20 breaths per minute. This is the average range in healthy adult at rest. The ideal position for taking rectal temperature is option A supine, option B sitting, option C left lateral, that is Sims position, option D Fowler's position. The correct answer is option C left lateral position, that is Sims position. Sims position provides comfort and safety during rectal procedures. A nurse washes hand before and after patient care to option A show discipline, option B prevent cross infection, option C maintain routine, option D save time. The correct answer is option B prevent cross infection. Hand hygiene is the most effective infection to control infection. The first step in nursing process is option A diagnosis, option B planning, option C assessment, option D evaluation. The correct answer is option C assessment. Nursing process begins with the data collection about the patient condition. The full form of PRN is option A per requirement needed, option B post routine nursing, option C pro Renata, option D patient record note. The correct answer is option C pro Renata. When required, PRN orders are carried out as needed, not on a fixed schedule. The Fowler's position is mainly used for option A spinal anesthesia, option B feeding or breathing difficulty, option C rectal examination, option D shock. The correct answer is option B feeding or breathing difficulty. Sitting upright eases lung expansion and swallowing. The nurse's uniform symbolizes option authority, option B purity and service, option C fashion, option D seniority. The correct answer is option B purity and service. While white reflects cleanness, honesty, and dedication to care. Which route gives the fastest drug? Which route gives the fastest drug absorption? Option A oral, option B intramuscular, option C intravenous, option D subcutaneous. The correct answer is option C intravenous. IV drug enters directly into the bloodstream for immediate effect. The normal adult pulse rate is option A 40 to 60 beats per minute, option D 60 to 100 beats per minute, option C 100 to 120 beats per minute, option D 120 to 140 beats per minute. The correct answer is option D 60 to 100 beats per minute. Pulse below 60 is bradycardia, above 100 is tachycardia. The best site for IM injection in adult is option A deltoid, option B ventrogluteal, option C vastus lateralis, option D forearm. The correct answer is option B ventrogluteal. It avoids major nerves and vessels, make it the safest IM site for adult. The first nursing school was established by option A Clara Barton, option B Florence Nightingale, option C Mary Elzia Mahoney, option D Virginia Henderson. The correct answer is option B Florence Nightingale. She opened the first school at St. Thomas Hospital, London in 1860. The instrument used to check temperature is option A sphygmomanometer, option B thermometer, option C manometer, option D barometer. The correct answer is option B thermometer. It measures body temperature in Fahrenheit or Celsius. Oral hygiene should be provided at least option A once daily, option B twice daily, option C once weekly, option D after every meal. The correct answer is option B twice daily. Regular mouth care prevents halitosis and dental decay. The 5 rights of medication administration include option A drug right dose, right route, right time, right patient. Option B, doctor, nurse, label, time, dose. Option C, name, ward, color, expiry count. Option D, drug, syringe, site, date, nurse. The correct answer is option A, right drug, right dose, right route, right time, right patient. Following these right ensures safe drug administration. The normal urine output in 24 hours for adult is option A, 200 to 400 ml. Option B, 500 to 800 ml. Option C, 1000 to 2000 ml. Option D, 3000 to 4000 ml. The correct answer is option C, 1000 to 2000 ml. Average output approximately 1500 ml per day indicates proper kidney function. The nurse checks blood pressure using stethoscope. Using option A, stethoscope only. Option B, sphygmomanometer and stethoscope. Option D, thermometer. Option D, pulse oximeter. The correct answer is option B, sphygmomanometer and stethoscope. Coruscant sounds are heard through the stethoscope while releasing cough pressure. The main goal of aseptic technique is option A, destroy spores. Option B, prevent infection transmission. Option C, sterilize air. Option D, promote wound healing. The correct answer is option B, prevent infection transmission. Asepsis means freedom from pathogens during patient care. The best method of disposing infections waste is option A, open burning. Option B, landfill. Option C, incineration. Option D, recycling. The correct answer is option C, incineration. High temperature incineration destroy pathogens and shop safety. The main purpose of patient bed making is to decorate the ward. Option B, make the nurses work easy. Option C, provide comfort and prevent complications. Option D, impress relatives. The correct answer is option C, provide comfort and prevent complication. A well-made bed promotes rest, prevent bed sores, and enhance cleanliness. The nurse check the apical pulse using option A, fingers. Option B, thermometer. Option C, stethoscope. Option C, sphygmomanometer. The correct answer is option C, stethoscope. The apical pulse is read over the apex of the heart with stethoscope. The full form of ADL is option A, after daily living. Option B, activities of daily living. Option C, aseptic dressing level. Option D, advanced drug list. The correct answer is option B, activities of daily living. ADLs include bathing, dressing, eating, toileting, and mobility. Essential nursing assessment. The nurse uses a bag rub to option A, waste time. Option B, clean the patient's bag. Option C, promote circulation and relaxation. Option D, apply lotion only. The correct answer is option C, promote circulation and relaxation. Back care improves comfort, prevent vessels, and increases skin blood flow. A patient with fever should be given option A, cold bath immediately. Option B, tepid sponge bath. Option C, hot water bath. Option D, no bath at all. The correct answer is option B, tepid sponge bath. A tepid sponge bath lower body temperature safely and provides comfort. The nurse observes cyanosis in a patient. This indicates option A, fever. Option B, lack of oxygen. Option C, dehydration. Option D, high blood sugar. The correct answer is option B, lack of oxygen. Bluish discoloration of lips or nails shows poor oxygenated, that is hypoxia. The nurse should record the intake and output chart to check digestion. Option B, maintain nutrition. Option C, assess fluid balance. Option D, identify infection. The correct answer is option C, assess fluid balance. Monitoring intake and output help prevent dehydration or fluid overload. The recommended needle angle for intramuscular injection is option A, 15 degrees, option B, 45 degrees, option C, 90 degrees, option D, 120 degrees. The correct answer is option C, 90 degrees. The needle is inserted perpendicularly into the muscle for IM injection. The color code of a biohazard bag for infectious waste is option A, blue. Option B, yellow. Option C, red. Option B, black. The correct answer is option B, yellow. Yellow bags are used for infectious and pathological waste in hospital. The nurse should position the unconscious patient in option A, supine position. Option B, prone position. Option C, lateral. Option D, follower's position. The correct answer is option C, lateral position. The lateral or side-lying position prevent tongue fall and aspiration in unconscious patient. The main source of hospital infection is option A, air. Option B, food. Option C, hands of health workers. Option D, visitors. The correct answer is option C, hands of health workers. Unwashed hands transmit most hospital-acquired infection. Hand hygiene is critical. The best position for patient in shock is option A, follower's position. Option B, supine position. Option C, Tendenberg position. Option D, prone position. The correct answer is option C, Tendenberg position. These Trendelenburg position legs are elevated to promote blood flow to vital organs. The nurse uses a stethoscope to option A, measure temperature. Option B, measure pulse pressure. Option C, listen to heart, lungs, and bowel sounds. Option D, check reflexes. The correct answer is option C, listen to heart, lung, and bowel sounds. Auscultation helps assess internal organ functions. The normal range of systolic blood pressure in adult is option A, 60 to 80
mm of Hg, option B 80 to 100 mm of Hg, option C 100 to 120 mm of Hg, option D 120 to 60 mm of Hg. The correct answer is option C 100 to 120 mm of Hg. Normal blood pressure is around 120 by 80 mm of Hg. Values above 140 by 90 mm of Hg indicates hypertension. When performing hand washing, the nurse should wash hands for at least option A 5 seconds, option B 10 seconds, option C 20 seconds, option D 1 minute. The correct answer is option C 20 seconds. Washing hands for 20 seconds remove most microorganisms effectively. The nurse uses sterile gloves when option A making the bed milk, option B giving oral care, option C performing dressing or invasive procedure, option D taking history. The correct answer is option C performing dressing or invasive procedure. Sterile gloves prevent transfer of microorganisms through open wounds or sterile feeds. The patient's chart is a option A legal document, option B personal diary, option C confidential letter, option D daily planner. The correct answer is option A legal document. All nursing records are legal evidence of care provided to the patient. The term asepsis means option A presence of germs, option B absence of disease producing organism, option C sterilization, option D chemical disinfection. The correct answer is option B absence of disease producing organism. Asepsis ensures a microorganism free environment for safe procedures. The safest way to move a patient from bed to wheelchair is option A pull the patient quickly, option B ask the patient to jump, option C use proper body mechanism and assistant, option D drag the patient. The correct answer is option C use proper body mechanism and assistant. Proper technique prevents injury to both the patient and nurse. Which principle is important in body mechanism? Option A keep leg straight, option B keep back out, option C keep load close to body, option D bend from waist. The correct answer is option C keep load close to body. It reduces strain on back muscles and maintains stability. A nurse should report a pulse rate below 60 beats per minute as option A normal, option B tachycardia, option C bradycardia, option C arrhythmia. The correct answer is option C bradycardia. Bradycardia means slow pulse rate that is below 60 beats per minute. It requires medical attention if symptomatic. The purpose of a nursing care plan is to option A decorate the file, option B provide systematic individualized care, option C replace doctor's order, option D maintain records only. The correct answer is option B. A nurse care plan ensures goal oriented patient centered nursing interventions. The most important quality of good nurse is option A beauty, option B sympathy, option C punctuality and compassion, option D strictness. The correct answer is option C punctuality and compassion. A care attitude and dedication build trust and healing relationship. The instrument used to measure oxygen saturation is option A spirometer, option B pulse oximeter, option C manometer, option D barometer. The correct answer is option B pulse oximeter. It measures oxygen saturation SpO2 non-invasively using finger sensors. The first step in any nursing emergency is to option A shout for help, option B run to the doctor, option C assess the patient airway, breathing, circulation, record the case. The correct answer is option C assess airway, breathing and circulation. ABC assessment identify life threatening conditions and guides immediate action. Thank you all.